When you visit a Bale Doneen Method clinic, you will find a variety of tests that are used to uncover hidden risks. The IMT scan is used to check main arteries in the neck. If plaque is located here, most likely it can be found everywhere in the body. What is most important is to determine the age of the arteries and if plaque is present. If it is found, the type of plaque and thickness is considered.
Several years ago, we started using a test that's actually been used in research for about 18 years. It's called carotid intimal thickness testing, and it uses the B-mode ultrasound, just sound waves, to look at the carotid artery, which of course is the big artery found just underneath the skin in the neck. It's a totally painless test. And with that mode of ultrasound, you can actually see the wall of the artery, and we know from the data that's where the disease is.
It also gives us some objective tool to one, establish standards as far as risk reduction. In other words, if someone's got plaque in their vasculature, we know we may want to set standards that are more aggressive for treatment. The other piece is it gives us an objective structural element to monitor with treatment. In other words, we can take a look at that on an annual basis and say, are you getting better? Are your arteries getting better? Because that's what we really want to know. Are we fixing the vascular problem?
Individuals who get the typical medical standard of care and its lacking risk factor analysis and standard treatment often go on to have a heart attack or a stroke. The cost in lives, loss of quality of life, and family financial security is skyrocketing under the standard system we have today. The Bale Doneen Method assesses and treats many additional risk factors, allowing for a much greater reduction of heart attack and stroke risk. The Bale Doneen Method is designed to incorporate a continuous review and analysis of risk factors. Once you come on the program, follow-up and regular scheduled testing and counseling is essential.
Well, the total cholesterol is quite low right now. The bad LDL, I right now have only 1/4 as much bad LDL as I had 2.5 years ago. So I've dropped just like a rock with the bad LDL. My HDL has gone up substantially, especially the really good HDL2.
One of the most remarkable things I ever experienced in my life was he put me on a diabetic medication. I didn't know how bad I felt before until after I took the medication. I said, oh wow.
We found a little soft plaque in my arteries, and all of it's calcified. We found that my cholesterol was very high, and now it's not at all. We found that my blood pressure was slightly high, and now it's not at all. And so how do I feel about those results? I feel great.
Diabetes is reaching epidemic proportions. Several years ago, evidence emerged that a condition termed insulin resistance, which is responsible for adult diabetes, can be very damaging to the arteries prior to diabetes. In addition, evidence is accumulating that this condition is at the root of the majority of arterial disease. Insulin resistance is very common, which is clearly illustrated by the fact that adult diabetes is the fastest growing disease in the United States. During the first visit to the clinic, a fasting blood test is drawn. Patients are then given an orange drink high in sugar and glucose. After a 2-hour education session, another blood test is taken. The importance of this second blood test is to measure the pancreas function and the body's ability to maintain the proper insulin level in a short time period. It is possible to measure through this test how close a person is to becoming a full diabetic and verify if damage is occurring to arteries. The results sometimes indicate that a person is on the road to becoming a diabetic and the treatment needed to stop it.
I've been saying this for 7 years, and as the data keeps coming in, it certainly supports it, that the majority of arterial disease is actually rooted in a condition known as insulin resistance.
This condition goes on sometimes for an average of 20 to 30 years before an individual becomes diabetic. The good news is that early detection by this simple and inexpensive blood testing program provides a large window of opportunity in which to diagnose the problem prior to diabetes and avoid or halt the damage that is occurring to the arteries. Once identified, an individual can be effectively treated and diverted from this destructive path toward diabetes. Arterial damage can be stopped and even improved under the Bale Doneen method. Unfortunately, this window of opportunity is missed in the vast majority of individuals, and they do not find out about this condition until they are a full-blown diabetic. Think of insulin-resistant testing like this. The way the medical standard of care does it, with only fasting blood sugar testing, is a lot like how an iceberg might appear harmless to ships and boats. You only see a part of the picture. But what is lurking under the water is a killer. 1/3 of the ice is visible above the water, and 2/3 sits below the waterline in a deceptive way. If a ship does not start to turn quick enough, certain disaster awaits it. Ask the folks on the Titanic. If the course is not turned during the first 10 to 15 years, insulin-resistant people would begin to demonstrate one or more problems such as higher blood pressure, gout, weight gain, higher triglycerides, or lowering of good cholesterol, HDL. Men may have difficulty with erections, while women may have cysts on their ovaries. Like the iceberg that was too small to worry about or is overlooked, a terrible long-term disease and death may await those on board this course.
And insulin resistance is the cause of about 92% of adult diabetes. And adult diabetes is the fastest growing disease in the United States.
The standard of care almost always says there is no blood sugar problem at this point, and the healthcare provider will simply address the individual symptom and miss the underlying insulin resistance. This condition is prevalent and causes so much devastating disease.
Due to those facts, in my opinion, we need to run our practices the opposite of the judicial system in this area of medicine. And when a patient comes in with one of these, quote, red flags, like high blood pressure, erectile dysfunction, gout, etc., they need to be considered guilty of insulin resistance until we can prove that they're innocent.
If insulin resistance is allowed to continue, many factors will lead to an eventual collision with the diabetes iceberg. The blood sugar may remain normal because the pancreas has not been significantly damaged and is working double hard to overcome the resistance by producing high amounts of insulin to compensate. The Bale Doneen method is comprehensive enough to identify these individuals, oftentimes before the pancreas is damaged.
Dr. Bale and Amy Doneen have really identified a program that works and really focus in on the prevention, not after the fact. Let's head it off before. Let's make the quality of your life the best it can possibly be for as long as it can be.
There's been data out there for a long time now, and I think it's just now starting to be actually published that that the medications that they've been out for a while to treat diabetes, to actually help decrease patients' insulin resistance, they've actually got the data behind it now to prove that by doing that, you spare the pancreas. You know, it's like, hello, you won't have that pancreas fail.
After another 10 to 15 years, if undetected, the arteries will suffer many years of damage, and many of these people will start to have heart attacks and strokes. Roughly 25% of the pancreatic cells that make insulin have now been damaged, restricting the amount of insulin production. When a person has not eaten in 10 to 12 hours, there can still be plenty of insulin to keep the fasting blood sugar normal, cloaking a serious problem. If you have this problem, wouldn't you want to know about it now?
Because if that condition is anchored in insulin resistance, underneath the surface, not readily available, are all sorts of bad conditions going on that harm the arteries.
After another 10 to 15 years pass, now 20 to 30 years down this path, 50% or more of the pancreatic cells that make insulin have now been damaged. The pancreas, as you can see, cannot put out much insulin at all. Therefore, even when someone has not eaten for 10 to 12 hours, their blood sugar is too high. Unfortunately, this condition is now advanced to diabetes by the time the standard of care detects it. Healthcare providers just look at fasting blood sugar, and as a consequence, they will miss many people at this serious stage. It's a lot like being on an ocean liner with no sonar or radar. Would you choose the Titanic or a modern cruise ship with the best electronics and detection devices to travel the North Atlantic? Again, the comprehensiveness of the Bale Doneen Method allows us to identify these patients prone to hit the iceberg and turn well before it's too late. It is now estimated that approximately 54 million people in the U.S. are at this stage and are not diagnosed.
Everybody kept telling me, you don't have to worry about anything, you're going to live to be 100 because your parents, you've got such a good genetic background. So I was complacently rocking along thinking, well, I don't have anything to worry about, you know, because of my parents. But that's part of the issue is your heritage and your genetic background. But that's not all the story, because when I did these tests up in Spokane, I found I've already got disease.
I have always prided myself that I, take pretty good care of myself with diet, exercise, trying to stay fit, watch weight, things like that. So it was a eye-opener for me.
But my whole goal is to get my cholesterol into a healthy level and my blood sugar level at a level where I'm not going to become diabetic.
Because I got to tell you, when you get through one of these events, and many of the people watching this understand this, it is very difficult to make it work. To have the stamina, to have the energy, to have the desire to make it work. My left leg still doesn't work the way it should, and my left arm didn't work the way it should, and I'm exhausted many times just doing what used to be a simple little walk.
Blood pressure, 115/75. If we go 20 points higher than that on the systolic, which is your top number. So if we go from 115 to 135, we've just doubled cardiovascular death rate, not event rate, but death rate. And the same goes for that lower number, which if we set it at 75 and we go 10 points higher, 75 to 85, again we've doubled cardiovascular mortality rate, not event, but death rate. So how many people out there are walking around with 135/85 thinking they're fine, when we know statistically that they're at a twofold increased risk to die?
Doctors were informed several years ago that a diabetic who has not had a heart attack is considered at the same risk of someone who has had a major heart attack. Many people will not advance to this stage because they will die from a heart attack or stroke before they can get this far. Dr. Bale and Amy Doneen believe we must start identifying this devastating disease process long before the diabetic stage. The Bale Doneen Method effectively does this. Recently, it was estimated there are 20 million people who have diabetes, and millions are yet to be diagnosed. Mexican Americans and African Americans are twice as likely to develop diabetes than non-Hispanic whites. Diabetes eliminates the lower risk of heart attack and strokes generally seen in premenopausal women. Fortunately, the Bale Doneen Method will identify those who are sailing on this very dangerous course. It used to be that diabetes was not associated with heart disease, but now we know it is indeed under the surface of the problem. You cannot talk about one without the other.
And a lot of the advanced tests we do actually look at a lot of those problems that can be under the surface. So due to the advanced testing that we're doing, we feel we can identify all of these patients, even during the first 10 to 15 years, that they're insulin resistant.